So there's several different guidelines that support the use of ENO, the American Thoracic Society, the Global Initiative for Asthma, or the GINA guidelines, the NIH, and the U.S. Department of Health and Human Services. So we'll walk through some of these. The ATS says that patients with asthma where you're considering treatment, they would suggest using an ENO really to guide whether or not to use inhaled corticosteroid or how much corticosteroid to use. The Quad AI and the American College of Allergy, Asthma, and Immunology both recommend as well using ENO. It's a quick, simple, reproducible measure that's been standardized for clinical use. And it's used in measuring airway inflammation, and they specifically say it's been a paradigm change in the diagnosis and management of asthma. The GINA guidelines use this in a couple different sections. One is in their asthma diagnosis section. Of course, we still take a patient history and we look for airway obstruction on spirometry, and we can look at peak flows if spirometry is not available. But then additional tests to help identify type 2 inflammation include exhaled nitric oxide and peripheral blood eosinophils. And they go on to say that using ENO to support the diagnosis of type 2 asthma can be useful in selecting medications. ENO is higher in type 2 asthma, especially with elevated interleukin-4 and interleukin-13 levels, like we talked about when I mentioned that dupilumab trial. And higher ENO levels can support the decision to start an inhaled corticosteroid, and we referred to that with our ATS statement previously.